Medical shows have been a TV mainstay for decades. Dr. Doug Ross rose to fame on ER, and McDreamy dominated Grey's Anatomy. But OB-GYN Dr. Jackie is the new doc on the scene, delivering plenty of drama on her hit reality show, Married to Medicine. And she's just getting started.
I'm an OB-GYN by day. I've taken care of some of the creme de la creme patients. I've delivered the Braxtons. I delivered T.I. and Tiny's baby. I have taken care of Usher and his first wife. By night, I have been on a reality TV show for 8 long years.
That's a good deal. That's a great deal.
I used my life as a teaching tool. Thou shalt not be alarmed by natural, normal vaginal discharge. I see sometimes 40 women a day. And just knowing that women are embarrassed to talk about something that is so natural, I wanted to get rid of the taboo of this is something we can't talk about. No vagina is making history. And when I talk about this, I get a hot flash. In the future, I want to appeal to the masses that your greatest wealth in life is your health. So I am going to do everything in my power to instill healthy thoughts, whether it is mind, affirmations, whether it is body, exercise, eat right, and whether it is your spirit, is to find a way to create comfort and compassion in your own life.
Dr. Jackie joins us from Atlanta. Dr. Jackie, always good to see you.
Yes, thank you. Thank you for having me.
But Dr. Jackie, you've had more than your share of healthcare crises. And you've been open about your fertility struggles. So we want to ask, is it behind you or is this still weighing in on you?
I work every day, guys, to make sure that it stays in the back of my head because I'm an OB-GYN and I can't allow that to cloud my vision as I see patients. But definitely the fertility struggles are real and I never forget it. I have triggers and moments that it will come up and definitely make me very tearful, but I still wish for that daughter that I wanted who would be a pain in my neck and who would steal my clothes and do everything we do. But, I don't spend my time sad and depressed about it. I actually make jokes with the patients like, I'm going to give you this baby. You can't bring it back. There are no refunds, no exchanges. This baby is yours to keep. So I really don't live in that place.
You're very candid on the show about your struggles with becoming a mother, and Drew and I are both dads, and so we know how you feel. Even though we have kids, we know what you want and how tough that could be. And you actually say that you were robbed of motherhood not once but twice. Explain what you mean by that.
So my fertility my natural fertility was taken away from the 6 months of chemo. And I'll be honest, I really had tried to do egg freezing, but the time didn't line up. So I did 6 months of chemo and I tried to, of course, get pregnant after, and I realized that the natural cycle wasn't returning and I never got pregnant. The chemo had stolen that fertility. Now to make it even more complicated, right after that, I decided, okay, breast cancer is behind me, then we'll go and adopt. And my husband set me up with a great adoption agency. And I made the initial phone call. And what I was told there is that I was not far out enough from the breast cancer, so I couldn't adopt for 5 years. And wow. I'm thinking, I don't have 5 years.
Is that because they were worried? They want to make sure that you are going to be alive longer, so if you bring a kid what's the reasoning behind that?
And that's exactly what they said, is that they try to make sure they're adopting a child into a healthy home, into a family and then my health wasn't stable enough, so they thought that might not be wise. And I mean, I sure understood it. I wasn't mad about it at all because that's not my personality to get to that place. So what I've tried to do, and I say this all the time, I try to take my pain and turn it into a purpose. And so with that, having had my fertility robbed not once but twice, I said, okay, what can I do to give back? So what I've done is co-founded a surrogacy agency, so where I can make sure that moms like me have an opportunity to have a baby.